guys, Jim Hoffman here from EMS Office Hours. These are your Monday Minutes, and today we're going to continue on with trauma and focusing a little bit on the eye, the ears, and dental injuries. And it's all part of head and spinal trauma. And before we get there, guys, I don't know if you know about this or not, but I have a free level membership over at TurboMedic that's got lots of digital content, hours of audio and video, practice exams, and even exclusive access to things like the private Facebook group. Go check it out if you're interested. It's 100% free. I don't like to call it a free membership because it does take your effort, your time, your attention to access this stuff, to learn it, to look at it, to read it, right? So I call it an insider. You're an insider member there. So go check it out. It's at emsseo.com/insider. So when I talk about this stuff, and I do this every time I do these videos, I mention why it's important. Because I feel that while this is key information, it's going to help you pass exams, it's not just for exams. It's also designed to build your knowledge base, to move your knowledge needle just a little bit. That's going to help you make better clinical decisions. It's going to help you write better reports. It's going to help you interact with other healthcare professionals, whether it's your partner, a nurse, a doctor, much more effectively. Okay, so keep that in mind, that this is sort of all ties in together, and it's not just to help you pass an exam. And I think you'll see that as you watch these videos and continue to on with them and watch previous episodes of the Monday Minutes. So we talk about eyes, ears, and dental trauma. And listen, while this stuff can be kind of graphic when you see it, an injury to an eye, an ear, an injury to dental, right? They are what can be called distracting injuries. So don't let that distract you, no matter how bad they may look. Most people are not going to die from an eye injury or from a dental injury or from an ear injury. So make sure you're not overlooking a life-threatening injury that could be going on with the patient that you need to address first. All right, just keep that in mind when you see these type of things out in the field or you see stuff on exams. Don't let an injury to an eye help make you overlook a comment or a part of a question that might be addressing an airway issue or a circulatory issue, right? All right, so let's talk about this real quick, guys. We talk about ear injuries, and the common injury there is something called barotitis, and this is where you get a sudden change in the barometric pressure. And when we talk about ear injuries, you want to treat it specific to the injury itself. Of course, controlling bleeding, ice for swelling, right? Cover and protect things like avulsions. Irrigate chemical injuries. You want to irrigate a chemical injury at least 2 or 3 minutes, at least 3 or 4 times for about 20 minutes altogether, right? Have the patient yawn or swallow if they have that full feeling in their ear where maybe that pressure is built up in there. Sometimes that will help clear that. Okay. Now, of course, you want to follow your local guidelines, what you're allowed to do or tell a patient to do. All right. But that's one method to go ahead and do that. All right. But again, cover the injuries. Don't let it get further contaminated. All right. Now, we talk about things like eye injuries. And a lot of times we get that from a blunt trauma, penetrating trauma, from a car accident, sports, fights, being bit by an animal, even chemicals. And we go back to the irrigation with that, okay, same type of thing. So find out the patient's history, what happened, what's the mechanism of the injury, what's their previous medical history, okay, ask if they have contact lenses, what medications are they on, right? That can help you when you look at things like their pupil reaction, all right, do they have equal reaction in their pupils? Is there a delay in the response? And what are their extraocular movements? Are they tracking? Do they say they have blurred vision? Look out for things like contusions, all right? Pain, photophobia. You might even look at their pupils and see something that looks like a tear, like it's a tear-shaped pupil. Corneal abrasions. Guys, this is painful to a patient. They'll tell you, feel that they have a foreign body there, okay? And a lot of times, gentle irrigation with that could help relieve that. Now, we talk about foreign body, you're going to be much more copious irrigation all right, because they're going to have that foreign body sensation when they're opening and they're blinking, right? So give them lots of irrigation for foreign bodies that might be in there. Not talking about foreign body like a pencil sticking in the eye. We're talking about something like sand, dirt, stuff like that. Okay. Now, continue on with some eye injuries here. Look at the traumatic hyphema you might get. That's blood that's in the anterior chamber of the eye. Okay, so when somebody has this, that's a lot of force with that. So consider spinal precautions based on your protocols, of course. Elevate their head. Now, if they have a globe rupture that's due to that, all right, or a scleral rupture, they're going to say they have decreased vision. The eye is going to maybe feel soft. They might tell you it feels soft, it feels weird. And their pupils are going to be irregular. All right, again, think about immobilizing the spine with these patients, elevating the head, and you want to protect the globe from dehydration. So a lot of times protocols will tell you to use a saline moistened gauze pad over the eye. Okay, you want to press hard, gentle pressure to put it there and keep the globe moist, keep it hydrated. Okay, again, follow local protocols and what they suggest you do for traumatic injuries to the eye. All right, and again, guys, don't remove impale objects, all right, from the eye. Again, they have a pencil sticking out of their eye. Don't take it out. Secure it in place, but you want to cover both eyes so that the other eye isn't moving in concert with the injured eye or blinking and things like that. All right. Again, we talk about chemical injuries with the eyes, guys. You want to go and irrigate it at least 20 minutes. And for your bleeding, control the bleeding like you would anything else. Care for wounds and avulsions like you would anything else. But you want to do it with gentle pressure, not severe, like crazy direct pressure like you would if they were bleeding on their leg or their arm or something like that. Gentle pressure, especially when we talk about injuries to the globe, okay? So with that said, I want to round it out with the dental injuries here and dental trauma. And one of the most common things when you have injuries to the teeth are fractures, avulsions of the teeth, of the tongue, of the surrounding mucous membranes there. So you might have a very kind of bloody mess on your hands, right? Now, this dental trauma could be one of the more life-threatening injuries that I mentioned early on, because when you've got blood, it can obstruct the airway, right? So be alert for that, all right? You might have to suction. You might have to remove fragments of teeth and things like that. Now, if they can get reimplanted, if the tooth is broken in a way where you feel it can be reimplanted, that usually can be done within about an hour, depending upon where you are, what your protocol states. I've seen where you can save that tooth in sterile saline, or you wrap it in a gauze pad and sterile saline. You don't want to rinse it, okay? Or put it in milk, I've seen. So whatever your protocols will say is what I would follow. I think the common thing nowadays is putting it in a saline moistened gauze to keep it sterile and keep it wet. You don't want to rinse it because there's microscopic things there that you can't see in the back of an ambulance that you don't want to rinse off. Okay, so take it to the hospital. Try to get to the hospital that has a dental sort of trauma team that can help replant it if necessary. All right, alert them of what you're coming in with. All right, and like I said, guys, we talk about dental trauma. It can be a lot of blood, a lot of mess there. Keep aware of the airway being obstructed by blood and saliva or teeth, things like that, right? This is where this injury can be life-threatening. So make sure you're clearing that airway, and if you have to suction, that's your primary concern, right? Depending upon the injury for this patient, not saving their teeth to get replanted. Your primary concern is to secure that airway and make sure that they can breathe and that they can move air, okay? So that is it, guys, for today. We're going to wrap that up. Like I mentioned before, guys, I hope you'll join me as an insider membership over at TurboMedic. Very easy to join. Just go to emsseo.com/insider, and I hope I'll see you in the members area. Guys, as always, if you have some comments and concerns or want to see some stuff here on EMS Office Hours in the Monday Minutes, give me a shout. You can contact me at any of these social media platforms, and I hope you join me on these social media platforms. I do a lot of stuff on these things, personal stuff, but also a lot of stuff that deals with EMS and to help you be a better EMS professional. So go follow me on any one of these channels. I'm at EMS Safe on Instagram and Twitter, and on Facebook, it's the EMS Professional. So go check me out there, guys. And as always, like I said, you have your own Monday Minutes. Send them on over to me. My email is contact@emsofficehours.com. And be sure to go check out emsofficehours.com for other Monday Minutes, the podcast, and other stuff that goes on there on the blog. All free for you to check out there, guys. All right, that's it, guys. As always, I am Jim Hoffman for EMS Office Hours in the Monday Minutes. Stay safe.